You may already know that your genetics play a really important role in the health of your future offspring. As a couple, knowing about your genetic backgrounds may reveal any risk of disease in your current and future children. But how can you know? Carrier screening involves extracting DNA from blood samples taken from a couple considering having a baby and analyzing it for mutations that cause the most common inherited diseases. A panel of genes is used to identify any possibilities that the couple will pass on genes that might cause diseases in their future children. Each person has 2 copies of every gene, one from their mother and one from their father. Carriers are people who have one normal gene and one abnormal gene, but are not affected by the disorder from the abnormal gene. Although carriers are usually healthy, there is a chance that the genetic condition caused by the abnormal gene can be inherited by their children. Knowing this information will be helpful in deciding the next steps to take in the reproductive process. Some common conditions which we screen for are cystic fibrosis and spinal muscular atrophy. People from certain ethnic backgrounds may also be more susceptible to more rare genetic disorders. Consult with your doctor to determine which disorders you should test for. With our carrier screening test, you can find out if you carry mutations that could be passed on. These tests utilize next-generation sequencing, or NGS, which is the latest technology available in human genetics. NGS provides accurate and thorough results for almost any genetic mutation. A targeted approach is used to examine important genes that are associated with the most common genetic disorders. These genes are isolated from the rest of the genetic material and sequenced at a deeper level to reveal any variations that might lead to disease. How do you know if the test is right for you? The test can be requested by all couples, as anyone can be a carrier. However, it may be recommended for certain ethnic backgrounds that have a higher incidence rate for specific diseases. For example, some genetic disorders are more prevalent in people of Ashkenazi Jewish descent, such as Tay-Sachs disease and Canavan disease. For you, taking this test is very easy. Our carrier screening test only requires a simple blood draw, and within 2 weeks, a detailed report is sent directly to your doctor. Want to learn more about Reprogen carrier screening options? Prior to starting your family, you should speak to your physician about screening with Reprogen. We look forward to serving your very important genetic testing needs. In terms of trying to start a family, there's a 50% chance that your genetic mutation could be passed on to your children. The PGD compatibility test is an important genetic test to consider when planning a family because it can help determine the risk of having a child with inherited genetic disease and/or hereditary cancer. We offer 2 compatibility tests. The first is the PGD Carrier Screen Compatibility Test. Couples considering having a baby may wish to have their DNA tested to screen for mutations in certain genes that are associated with common and rare inherited diseases. This allows them to determine the possibility that they will pass on genes that may cause genetic diseases in their future children. In the occasion of the couple receiving results indicating that they are carriers for mutations in the same gene, Reprogen can further aid their family planning process by performing the PGD Carrier Screen Compatibility Test. This test can prevent the transmission of disease to their baby by analyzing their embryos during an IVF cycle for the specific mutations that they carry. The second is the PGD Hereditary Cancer Compatibility Test. Similar to carrier screening, a couple considering having a baby may wish to have their DNA tested to screen for mutations in certain genes that are associated with common and rare hereditary cancers. This allows them to determine the possibility that they will pass on genes that may cause cancer in their future children. When a couple receives results that include a disease-causing mutation, they can choose to use the PGD Hereditary Cancer Compatibility Test with Reprogen to detect this specific mutation in their embryos during an IVF cycle.